Hi, it's Dr. Montgomery, and I'm one of the doctors here at Enclave Vision, and I'm excited to talk with you today about our Atropine program. Atropine eye drops are compounded at a compounding pharmacy, and they are very important and the simplest strategy used in our management options for myopia. Atropine works on the focusing system of the eye, and it plays a significant role in our younger patients aged 5 to 9, where managing myopia with another strategy like the orthokeratology lenses or daytime contact lenses is more difficult. Our Atropine program is custom, and it's based on your child's age, rate of progression, and amount of myopia that they have. We also review outside factors such as device time and outdoor time that are directly related to the progression of myopia. Atropine in certain concentrations is clinically proven to control the progression of myopia, and Dr. Hinks and I keep up with the literature on the most effective atropine concentrations. The LAMP study is a great study if you would like to read more about the efficacy and safety of atropine. So how does atropine work? From a pharmacological level, atropine acts as a reversible, competitive antagonist for acetylcholine. It targets receptors in the retina and sclera to reduce myopia progression, and the stretch is what's dangerous for the eye. Atropine slows down the stretch by acting on these receptors. So applying the atropine drop mildly dilates the pupil, temporarily paralyzing the focusing muscle inside the eye, and research shows that it slows myopia progression by relaxing this focusing mechanism. It works to control the nearsighted prescription from getting worse every year. Atropine is a drop placed in each eye at bedtime every night. Your child will wake up in the morning and be able to go about doing regular activities in the day. If your child wears glasses, they'll continue to wear their normal glasses. If they're unaided or wear nothing, then they'll continue wearing no glasses. Atropine does not correct vision like the ortho-K lenses. So how does this work for your child? The strength of atropine used is patient dependent. It's largely based on the age of your child and the degree of myopia. Dr. Hinks and I determine the correct dosage and order from a compounding pharmacy. There are many local compounding pharmacies, and there's an online pharmacy we use often called OSRX, where the atropine is mailed directly to you. You or your child will instill a drop at night right before bedtime. 1 to 2 weeks before starting atropine, we'll have your child practice with an artificial tear to help them desensitize getting close to the eye. There will be a follow-up appointment beginning at 1 month from the first night you place in the atropine drop. Every patient is different. Depending on how your child is doing at the 1 month appointment will determine the next appointment. Typically that is 6 months from the 1 month appointment. Together, we'll work to ensure that your child is also doing behavior modifications to help stabilize their myopia. The only contraindication to atropine is heart conditions. Are there any side effects? Atropine is a specific dilation drop similar to the ones we use in the office every day. It is a compounded low dose, but because it is a mild dilation agent, it does cause mild pupil dilation. With that, your child might experience some light sensitivity and sometimes some near vision blur. This is more common in higher concentrations and will stop once the atropine is discontinued. On a personal note, many of you know that I have a very high prescription. I'm a -11. So I've always been an avid reader, and genetically I have my dad's eyes. The difference now from when I was growing up is we have a way to slow myopia that does work. I'm watching my own children closely because genetically they have the potential to have a very high prescription. For my son that is 6, atropine would be a great option for him if he were to show early signs of myopia. So we're using science, and now we have the ability to give him better vision than I have, which is why myopia management is such a big passion for myself and Dr. Hinks.